is I will advise you not to push. Don't push. It will feel like you want to go to toilet. I know it's very difficult to navigate this process. Imagine you want to poo, someone is saying you should not poo. Until you are asked to push or to poo, don't do it, because if you do it, it's going to tear your, that place is going to scatter. The baby will scatter. So it's better let them. Hi, beautiful mamas. Welcome back to the channel. If you've been following my video for the past few days, you'll notice that we've talked about the first trimester in pregnancy, second trimester, and the third trimester. So today we are going to be talking about the most anticipated part of the whole journey, which is labor and delivery. So if you're a fresher, a first time mom, or you're an OG, you want to refresh your memory, you know that all pregnancies are not the same. This video is for you, because in this video I'll be taking you through the signs of labor, the things you should expect, how to navigate through the signs, and then the whole delivery process. So grab your popcorn, sit down, I relax while I take you down through the journey of labor and its process. Hi, beautiful mamas. My name is Daisy Peter, a content creator based in Port Harcourt. I'm a mother of 3 beautiful kids. All I do here is give pregnancy tips, motherhood experience, healthy tips for your baby. And mind you, all my teachings here are based on personal experience and research. You can still ask your doctor, you can still go to your doctor for consultation. So that being said, let us dive into today's topic, labor and its sign, the things you experience. So let us talk about labor. What is labor? Labor is that time, the process through which your body is now ready to give birth. Your body is ready to deliver that little baby that's been in your womb for over 9 months. So it involves the cervix opening and tightening, tightening and opening, preparing for the baby to come out. So this whole process, which is called a dilation, it involves your cervix opening. Your stomach will contract a little, it will open. Then in that process, your cervix will be opening, which is called a dilation. This is what takes place in the labor process. So your uterus is going to contract to help the baby move down your birth canal. Your womb will start contracting so that it will help your baby to start moving down slowly through the birth canal. So now that I've known what labor is, let us now talk about the signs that you should expect, the signs that you should know that this is labor. Number one is painful contraction. Painful contraction is when your stomach, I will explain this in a layman's language so that you're going to understand, especially for the newbies. I will not use any big medical terminology. I will come down to your level so that you understand. So, like I said, number one is painful contraction. In painful contraction, your stomach will tighten, it will loosen, it will tighten, it will loosen. For the first time, it's not going to happen every time. It can happen every 30 minutes. But when that pain comes, it's very painful. It will come and then it will stop. So that is one of the signs to look out for in pregnancy. Or not, sorry, that's one of the signs for you to look out for in labor. Another sign is breaking of water. You know, when your baby is in your womb, your baby is inside a sac, and in that sac there is water, that is fluid. That is what keeps the baby healthy and alive in the womb. That's one of the things. So that sac of water that has been holding your baby for a very long time will break. Then if you're seated, you feel some kind of wetness in you, your undies and everything will be wet. You feel that you urinated on your body. No, that is another sign that your baby is ready to come out. It's another sign of labor. Another sign to expect is bloody show, which is also called the mucus. Some people call it show. Yes, it looks like something like kata kind of, and it's very thick. Some comes with blood, some does not come with blood. When you go to urinate and that, you just see it in your panties, very thick, and it will be drawing. When you see this, know that is a sign of labor. It is getting closer, it is getting nearer for your baby to come down. Another sign to watch out for is lower back pain. There is this intense lower back pain that will now be coming. You will feel it very strong. You have this painful, maybe if you're someone that have not been having lower back pain For days you'll be witnessing this lower back pain. And mind you, labor pain does not happen most times in a day. Some people, it can start in it will start today, tomorrow. It will be giving you sign little by little. One sign might come today, another sign might come tomorrow. Others can happen at the same time, but others will also happen one day one sign, second day one sign, just like that. So it's gradual. Some is very fast, some is very gradual. So if your own is the one that comes one today, one tomorrow, don't worry, it's normal. Then lastly, increase pelvic pain. Your pelvic is going to have this pain. It's going to be very sharp. Like when I gave birth to my third child, my pelvic pain is one of the signs that I noticed before I went to the hospital. And when I got there, they said I was already 4 centimeter dilated. That's my cervix. The place, the birth canal has already opened up to 4 centimeters. Yes, and for you to give birth, the cervix will have to open up to 10 centimeters. So mine has already opened up to 4 centimeters, and it was through the pelvic pain because it was not my first time, it was not my second time. That was how I knew that this serious pelvic pain must be labor. And when I got to the hospital, it was confirmed that I was already 4 centimeters gone. So pelvic pain is another sign that you should look out for when you're expecting your baby. But mind you, all symptoms, all of this sign might not come. So when you notice, even if it's one or two, just call your doctor. Do not wait for you to notice these 5 signs that I mentioned. If one or two happens, you can just quickly call your hospital, call your doctor. They will tell you what next to do. So now that we've known the signs of labor, what you should expect, we are going to be talking about the stages of labor, and I'm going to dissect it in 3 different stages. We are going to talk about it in 3 different stages. Number one stage is early and active labor, which is the cervix dilation. And active cervix dilation takes place from 6 centimeter to 10 centimeter. Like I told you, that process where your cervix is now opening for your baby to come out, it is called dilation, and it is measured from 0 to 10. Once it gets to 10, then it is time for your baby to come out. So the first stage is early and active labor, which is your cervix dilation. Your cervix will start dilating, it will start opening for the baby to warm up, for him or her to come out. And in this stage, contractions now get stronger and stronger and stronger, because it is that contraction that will make you to push. It is that contraction that will help you to, that will make you to push. So that now brings us to the second stage of labor, which is pushing and birth. So in the pushing and birth stage, baby is born in this stage, but it can last for some few minutes, it can last for hours, depending on the situation. In a situation where there is no complication, under 5-10 minutes, your baby is out. All the struggle, all the pain will just vanish. With one push, two push, your baby is out. When there is no complication, it doesn't even take up to 10 minutes for you to give birth to your baby. Like mine, I always push 2 times, and I'll just give God the glory. It's not my power, it's not my might, it's God that has been doing it for me. And my prayer is that as you're watching this, if you're about to go to the delivery room, you're in your last trimester, your testimony will also be like mine, in the mighty name of Jesus. In a video, I'm going to narrate how I gave birth to my 3 different children miraculously, no labor pain and all that, but that's a story for another day. So let's go over to the third stage of labor, which is the placenta delivery. You know, placenta is what connects you and your baby. The placenta supplies oxygen, the nutrients from you to the baby. So after you've given birth, the placenta will not be needed again, because there is no baby for it to supply nutrients or whatsoever. So it is not time for you to push out the placenta. For some people today also complain that it's difficult for the placenta to come out, but mine, I will still give God the glory. Mine does not waste time. They will only tell me to cough. The placenta is out. The pushing is not even as that of a baby. So that's the last stage of labor. So I just walked you through the labor process, what you should expect in the delivery room, so that when you get there, you will know what you're going for. Do not be scared. Other people, you just tell yourself like, wait, me, this is what I always do. I told myself that I look at small children that have given birth before me, people that are even weaker than me. I told myself that if they can do it, I can also do it. So that should be a motivational factor for you. Tell yourself that if Mr. A entered and they came out alive, you can also do it. Nobody can do it on their own, but God on your side, you can do it. So now I just walk you through so that you see what you'll be expecting in the labor room. So let's now know when to call your doctor. You remember I've mentioned the signs: breaking of water, the contraction, your stomach will pain you, it will stop just like that as the contraction, you, the water breakage, the bloody show, that is the mucus and all that. So when you experience all of this, it is now time for you to call your doctor. They will definitely tell you or advise you to come to the hospital. So now let's talk about what happens in the hospital. If you've called your doctor and your doctor says you should come to the hospital, what they do first of all is they will ask a midwife or a midwife to take you to the delivery room. They will check your dilation level. I told you that dilation is like active dilation is from 6 centimeter, but there are some hospitals you go that they check and your dilation level is already 4 to 5. They will ask you not to go back again, that you should remain in the hospital. But in a case that you witness some of these and they check you and you've not dilated, they will ask you to go back. But if you've already dilated up to 4 5 centimeters, you're not going back again. They will not ask you to enter the delivery room. When you enter the delivery room, from time to time they'll be checking you to know how far you've gone in the dilation. And should I tell you what they use to check the dilation? They use their finger to insert in your birth canal. It's from there. I think because they are experts, so they know the level each finger will go in the centimeter. So that's what they do. So they will not prepare you for your delivery. While you're there, they will be checking how many centimeters you've gone until once you're 10 centimeters, you'll be asked to climb the delivery bed where they ask you to position your hand, your leg, and all the things you've been learning in your antenatal visit. That is time for you to practicalize them. So when you enter there, when it's not time and you have this serious urge to push, please, I will advise you not to push. Don't push. It will feel like you want to go to toilet. I know it's very difficult to navigate this process. Imagine you want to poo, someone is saying you should not poo. Until you are asked to push or to pull, don't do it, because if you do it, it's going to tear your, that place is going to scatter. The baby will scatter. So it's better let them use their own hand to do it than for the baby to tear it, because the tear the baby causes there can be very big. So don't push. So when you climb, they've observed everything is in order, then they ask you to push. So the way you do it when you go to toilet, that's the same way you push just like that. God's willing, once you just push once or twice, your baby will be out. Then you carry your baby. So that is what happens in the labor room. Like I told you, after you push your baby, then you will not push your placenta. So that is all. That is what goes on in the delivery room. There's nothing serious and all that. There are some hospitals you will go to, they will allow your partner, your loved ones to enter. Like where I give birth, I normally give birth with my husband. Such an amazing husband. For my 3 children, he will always be there supporting me. I feel like if he's not there, I won't be able to do it. So once I see him, I see strength in him. I see courage. I see the motivation for me to do it. So but in some government hospital, they don't allow anybody to enter there, because there are also some naked women there, and your husband cannot go there, your loved ones will not go there to go and see other people's wives privacy. So you understand. So that's what basically happened in the labor room. So if you've seen this video, my teachings, my words of encouragement has removed any labor fear from you, please, I want you to give this video a thumbs up, comment, and share, so that other mothers who are waiting for their delivery time will also see this video and they will benefit from it. If you found this useful, please like, subscribe, and comment. And see you in my next one, where we'll be talking about how to take care of your baby in the first 2 weeks of delivery. You remember, you're a newbie, you don't know how to navigate the process. So I'll be dropping down the video of how to take care of your baby that you just delivered, your baby of 1 2 weeks. See you in my next one. Bye.